COVID-19 is the ongoing pandemic that has affected the lives of people worldwide. Wearing a mask and social distancing are the main ways to prevent the spread of the pandemic. Wearing a mask properly is a key part of stopping the spread.
According to Johns Hopkins Medicine, people wearing masks in a variety of different styles, dangling from one ear, pulled down below the nose, or resting below the chin. These common mistakes decrease the effectiveness of masking and increase the wearer's risk of catching and spreading the disease. When anti-maskers choose to improperly wear their masks, it puts themselves and others around them at risk.
Masks stop the spread of air droplets that are spread when one breathes in and out. Since some symptoms are not prevalent as soon as one catches the virus, masks help to prevent the spread when one is unaware if they have caught COVID-19 or not. As reported by the University of California in San Francisco, and I quote, "In one simulation, researchers predicted that 80% of the population wearing masks would do more to reduce COVID-19 spread than a strict lockdown. If the population decides to wear their mask, the pandemic will be over sooner rather than later."
There is viable evidence that masks decrease the amount of positive COVID-19 cases among the population. According to the University of California, San Francisco, it found that mask mandates led to a slowdown in daily COVID-19 growth rate, which became more apparent over time. The first 5 days after a mandate, the daily growth rate slowed by 0.9 percentage points compared to the 5 days prior to the mandate. At 3 weeks, the daily growth rate had slowed by 2 percentage points. With this evidence presented, it is extremely important to take the proper precautions like wearing your mask to flatten the curve of death across the globe.
Yes, it is very crucial to wear a mask during the COVID-19 pandemic, but what some people turn a blind eye to is which masks are actually helping and which are hurting. There continues to be a variety of different styles and designs of masks made, but which are actually helping to stop the spread of the virus?
Neck gaiters. Many gaiters are made of synthetic fabric, and synthetic fabric has been shown to be less effective in preventing the spread of small particles, like the respiratory droplets of COVID-19. Additionally, in a recent study, it has been shown that neck gaiters are made of synthetic fleece may do more harm than good because they essentially aerosolize the wearer's respiratory droplets, meaning the wearer's air particles are being released out into the air ready to infect the next person. Disposable surgical masks. These masks are flat and thin and typically seen in white or blue coloring. These masks are meant to be disposed after use. They should not be worn more than once. These masks are shown to be effective in hopes to stop the spread of COVID-19. According to a 2013 study published in Aerosol Science and Technology, surgical face masks can filter out about 60% of smaller inhaled particles.
N95 face masks are shown to offer the most protection against COVID-19. N95s protect the person wearing the mask because they filter out 95% of the particles from the air breathed in. In contrast, other masks such as the disposable surgical or the cloth masks are more used to protect the people around them. N95 masks are in short supply and should be reserved for healthcare providers. Healthcare providers are in direct contact working with COVID-19 infected patients, so having the highest quality mask is extremely important for them. In fact, the CDC does not recommend the general public wear N95 masks.
Store-bought cloth mask. The effectiveness of store-bought cloth masks depends on the quality of construction. According to Johns Hopkins Medicine, when buying a cloth mask, you should be looking for at least 3 layers of fabric, and ideally from tight weave 100% cotton cloth. These would be considered highly quality cloth masks and can be up to 80 to 95% effective. A low-quality cloth mask would be very thin and not made of cotton. These low-quality masks are usually only 10 to 20% effective. These store-bought cloth masks come in a variety of fashionable colors and designs that can be very intriguing, but it is important to keep in mind the main purpose for the mask.
Death rates and positive confirmed cases of COVID-19 will decrease significantly when one wears their mask. It's important to remember wearing a mask not only protects yourself from COVID-19 and other viruses, but also the loved ones around you.
According to the World Health Organization, 271,233 Americans have died from COVID-19, and there have been 13,759,500 cumulative positive confirmed cases. As a nation with one of the best medical care systems, these numbers are horrific.
Wear your mask.